Today we will talk about environment and health tech. Focus on the relationship between environmental monitoring technology, air quality sensors, health data, and the impact of environmental factors on health. Digital technology and the use of data are transforming every aspect of human life, and there are no signs of this trend slowing down anytime soon. Momentum has been building over a long period of time, stretching all the way back to 1947 and the invention of the transistor, in essence the data transfer device underpinning the whole of digital technology. Skip through the following decades, and add in the launch of the first personal computer, the first mobile phone, the internet, 5 grams connectivity, and you have an ever-growing avalanche of data. According to Statista 2021, the total amount of global data is forecast to continue increasing rapidly, with a massive 90-fold growth projected from 2010 to 2025. Digital and healthcare. Digitalization is also a key trend in healthcare, touching almost every facet and opening up new opportunities for the delivery of care. We have already seen a huge step up in adoption of digital technology, especially post-COVID. As health-conscious consumers and capacity-stressed health systems turn to technology to help them address their challenges. Also, for those 3.5 billion people around the world who do not have access to healthcare today, digitalization holds the key to radical improvement in their lifetime, as digital solutions are intrinsically much more scalable, and thus support wider prevention, better triage, and lower cost per treatment. Today, Philips is already very much a digital company, with 1 in 2 of our R&D employees working in software development and data science. By integrating data, we are able to create smarter, connected health solutions. Applying clinical decision algorithms and predictive analytics, for example, we can use data to deliver personalized, actionable insights. For instance, to motivate healthy behavior through digital coaching, or to alert medical teams to potential problems. We believe that digitalization can accelerate the adoption of much-needed sustainable models of healthcare, including wider access to care, for example by enabling underserved communities to leapfrog the gap in provision of primary services. Having said that, making healthcare accessible to all of mankind cannot, must not, imply a doubling of healthcare's global environmental footprint, which is already horrendous. If healthcare were a country, it would be the 5th largest emitter globally, accounting for more than aviation or the shipping industry. Digitalization can help reduce healthcare's environmental footprint by enabling more efficient use of scarce resources, both energy and materials. For example, by supporting virtual care, or telehealth, and the shift from resource-intensive clinical settings to networked lower-cost settings in the home. And enabling dematerialization and circular service models such as usage and outcome-based models. So, what exactly do we mean by dematerialization? When thinking about how to address a customer's needs, we at Philips always ask ourselves, right at the start of the design process, how we can deliver value to our customers while avoiding or minimizing the use of materials? If we are able to create a virtual solution, it reduces environmental impact. Digital tools support the drive towards dematerialization, and as such touch upon the very essence of the circular economy, delivering maximum value with minimum resources. At the same time, we see that the footprint of the ICT infrastructure needed to deliver digital solutions is increasing. Electricity is required to run the hardware and software that transports data across the globe. It is estimated that more than 800 TWh is consumed yearly, roughly equivalent to the electricity usage of Belgium, the Netherlands and Germany combined. By 2030, 8% of electricity will be consumed by data centers. And it is forecast that by 2040, 14% of greenhouse gas emissions will be attributable to ICT. Currently that figure stands at 2%. To reduce harm to the environment resulting from the production, use, and disposal of health technologies. There are different options for how health technology assessment agencies can consider environmental information. We identified 4 approaches that agencies can use to take environmental information into account in healthcare decision-making and the challenges associated with each approach. Republishing data that is in the public domain or has been submitted to into agency we term the information conduit approach. Analyzing and presenting environmental data separately from established health economic analyses is described as parallel evaluation. Integrating environmental impact into TIS by identifying or creating new methods that allow clinical, financial, and environmental information to be combined in a single quantitative analysis is integrated evaluation. Finally, evidence synthesis and analysis of health technologies that are not expected to improve health-related outcomes but claim to have relative environmental benefits are termed environment-focused evaluation. The world's healthcare systems account for more than 4% of global CO2 emissions, more than the aviation or shipping sectors. Hospitals have the highest energy intensity of all publicly funded buildings, and emit 2.5 times more greenhouse gases than commercial buildings. In the United States, alone, hospitals also produce nearly 6 million tons of waste each year. The responsible and sustainable use of energy and materials is key to reducing healthcare's carbon emissions. Switching to renewable energy can have a major impact on large-scale, energy-intensive operations. Collaborating with other health systems, suppliers, and industry partners to offer the necessary scale can also greatly influence operations. For instance, virtual power purchase agreements, applying green procurement criteria when buying medical equipment, and investing in innovation. That involves circular action, recycling, refurbishing, and remanufacturing, are all gaining popularity in the healthcare industry worldwide. The energy consumption of medical equipment presents another opportunity for change. In my company, customer use of our products accounts for around 80% of Philips' total environmental impact. That's why we developed eco-design principles to reduce the energy consumption of our products, something that every company should be doing. What do you think of our video? Let me know in the comments section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.